Unconsciousness is a space which we believe has unlimited storage space. So in other words, what it means is that whatever sensations we have received since our birth is stored there. Now, in any given situation, when there is a given stimulus, like for example, I see a person in a mall and somehow I like him. Now, I have never seen that person, or you have never seen that person, but you may have positive feeling toward that person or negative feeling that person. It so happens that the person resembles very much like your fourth grade teacher, whom you liked or whom you didn't like. And the same likeness or dislikeness is transferred to the feeling towards that person. In older days, psychiatrists used to see patients, lying them in a couch, and the psychiatrist would sit behind on a chair comfortably, and the patients were asked to talk themselves loudly, whatever comes in their mind without any inhibitions. And the purpose behind was that somehow some conflicts which are lying in unconsciousness may surface up to consciousness, and the psychiatrist may pick up on it and try to resolve that conflict, which was believed is actually responsible for the psychic suffering, either depression, anxiety, or whatever. This is drastically changed now with the advancement in the subject, and actually to the extent that it has almost pushed aside. There are not many psychiatrists who are doing psychodynamic therapy anymore. There are many other forms of therapies which have been developed, which is like cognitive behavioral therapy, for example. I would also like to mention at this point of time that my talk is not for professional. It is mainly for lay people or people who are interested to learn more about this subject or to understand how mind-brain works. It is also important to mention that our body and especially our mind is not a static structure. It is not like a computer which you bought and is lying there and there is no change. There are a lot of changes which are taking place in our body from the time of our birth. Our cells die and they are replenished, new cells come in, older chemicals are degraded, newer chemicals are formed, and we keep on changing. It is a very important thing to understand that we are not the same biological matter which was 10 years ago. We may resemble very much, but we keep on changing in many different subtle ways. And of course, one can see that we pass through different developmental stages. We are born as a baby, and then we become infant and toddler and adolescent and so on and so forth. So obviously there is physical changes taking place in the human, but there are similar changes taking place inside our body also, in our chemical environment, in our blood environment, in our brain environment. So it is important to recognize the fact that human beings are not static. As I mentioned, the concept of subconsciousness and unconsciousness, it is a very important concept to understand, because a lot of time our unconsciousness would dictate our present day activity or our present moment activity or our response to any given situation. When we get a new stimulus or a new sensation, our brain scans it in a fraction of a second and goes through all the memory, consciousness, subconsciousness, unconsciousness, and then we react based on the stimulus, based on our mood at the given time, and based on our scanning of our past memories. So now you can understand that when I said that a person who has not read books has only lived once, means that his memory is very limited only to what 5 sensations he has received knowledge through. What he has seen, what he has tested, what he has read, what he has watched on TV, what he has heard. but otherwise his brain has no knowledge about it. At this point, you may consider, like, if you bring a person from second century to present time and you tell him that, my computer is not working, and he would say, what is computer? So unless you have new knowledge, unless you have the knowledge of that thing, your mind is blank. That is why it is said that we have very limited knowledge. We don't know what is happening in universe. The galaxy is so big. We are not able to analyze it because we don't have any knowledge of those things. So there are a lot of things which we are not in a position to rule in or rule out because we don't have that knowledge. Our knowledge is very limited. One of the signs of intelligence is the capacity to have original thought. Now, nobody has really original thoughts because most of our new thoughts are based or built upon our previous thought. So from one connection, we get another connection. And we may feel that it is a new thought, but actually there is an origin to it. It doesn't come out of blues. But there are some people whom I may say are more intelligent because they may find out new ways of doing things. And in some ways, those thoughts have not been thought before. So this is one sign of intelligence. I would like to give an example actually which happened with me and people who have knowledge of mental health, which is something called Freudian slip. Freudian slip is something which you do unconsciously, but it has some meaning. Now, I'll give you an example. I used to have a private clinic, and there were many journals which I used to subscribe for my patients in the waiting room. They would read it. So one time a guy who was selling a subscription came and he wanted to sell me that journal. And I said, I don't want it. I don't think it is of much interest to my patient. He kept on coming 2-3 times. And then finally I said, okay, let me get him off my back. And I bought the subscription. Now, something very interesting happened. You know what? My check came back. Why? Because I forgot to sign the check. Now, would I do that on purpose? Never. It would be sort of a crime. So because I had resistance, my mind made me not sign it. And these type of examples are scattered all over. And you will see in daily life. In psychiatric books, they give an example that a father had a conflict. And he was so angry toward his daughter that he wanted to hit her. And suddenly he felt that his hand was paralyzed. So he was really unable to raise his hand. So we have to understand, and I'll talk about it later on, which is called psychosomatic connection, the connection between brain and body. I think it is very less understood. And even in medical school curricula, the importance of psychosomatic illness or reaction or connection has not been emphasized enough. Having worked as physician in many different countries, I still believe that it is considered as a last option. But actually, in my own practice, and I have seen it is very, very common. And when the particular topic will come, I'll talk about it. I'll go through different psychiatric diseases one by one in detail. I will choose the subject which I think is very common and which would be of interest to general audience. Knowledge is power. A lot of time we do things because of ignorance and because we don't know any better. If you remember, when I was small in our society, using left hand was considered a bad habit. Like kids who were using left hand for writing, they were being physically punished because it was thought that they are either trying to irritate other people or they are just doing it on purpose. But people didn't realize that it was actually his or her biological predisposition. And that is how their brain worked. Now, when we have that knowledge, we are much more kinder, and we have accepted the fact that it is okay if the child wants to use left hand for writing. In psychiatry, there is a standard book which is called DSM-5. It stands for Diagnostic and Statistic Manual. It is not a textbook. It is a description of psychiatric illnesses, which is described by a group of experts, and it's considered as a Bible for mental health providers. So I will pick up some diseases from that manual, and I will talk about them in my subsequent talks and let people be more aware of them and to find out how best they can deal with those illnesses and how they can take care of their loved and dear ones who are suffering from these diseases.